Good afternoon, everyone, and welcome back. Yesterday was a very busy day. We had a Board of Supervisors meeting and we approved several measures to enhance our response to the pandemic, and I'd like to highlight just a few of those actions that we took. We had recently talked about creating a team to help local businesses and organizations comply with our important public health orders. We already have staff that is doing inspections and enforcement, but yesterday we voted to beef up that team with 22 new team members for a total of 35 now supporting that effort. They will respond to complaints received on our new Healthy Compliance call center. That call center is live now and will be staffed 24 hours a day, 7 days a week. The number for the call center is 858-694-2900. That's 858-694-2900. As calls come in, information about the complaint will be gathered, including location and what jurisdiction it is in. Once a complaint is received, a call will be made to the business or entity to discuss the problem or concern. The goal will be to relay the complaint, learn about their operation, and seek to determine if there is a violation. We will conduct site visits and continue to seek voluntary compliance, but also discuss enforcement options. We are coordinating with other local cities on creating partnerships when it comes to enforcement. Each city is different, and some cities will take a more leading role in these efforts, and we will support them. We want to thank all of the cities for their cooperation. In addition, we've talked before about enhancing our T3 strategy, especially with more testing in South County, where there are a lot of cases. Yesterday, we voted to add testing near the U.S.-Mexico border. We currently have between 20 and 30 testing sites in any given week across the county. Our closest testing site to the border is a walk-in site we run in partnership with the state at the San Ysidro Civic Center, which is approximately 2 miles from the U.S.-Mexico border. In the next couple of weeks, we will be piloting a no-appointment walk-up testing site at the border. The location is at the Ped West pedestrian crossing at the San Ysidro Port of Entry. This entry is for essential workers and U.S. citizens returning to the United States from Mexico, and our testing will focus on essential workers. We estimate that we can conduct up to 200 tests a day. And one last thing. Today, at the urging of Supervisor Jacob, we approved a proposal to make county parks available for outdoor worship services and fitness workouts. This will help entities with the restrictions on indoor activities. I want to thank Supervisor Jacob and my colleagues on the board, Vice Chairman Jim Desmond, Supervisor Kristen Gaspar, and Supervisor Nathan Fletcher for their support on these actions. Today, of course, we are joined by Supervisor Fletcher, who will touch on the other actions we took. He will also be followed by Dr. Wooten, and then we have a special guest, Mauricio Torre, who is the Vice President of Program and Operations at South Bay Community Services. We are working with our community partners to reach out to all residents on tracing, and he will talk about what they are doing in that regard. Without any further ado, let me introduce Supervisor Fletcher.
Thank you, and good afternoon. In addition to the enforcement actions Supervisor Cox mentioned yesterday, our board took a number of additional actions related to COVID. In particular, we took a significant step forward with trying to increase the availability of child care by allocating $25 million in CARES Act funding to support our child care providers in San Diego County. This investment will help provide financial flexibility that our child care providers need, particularly the smaller and nonprofit independent child care providers. These dollar amounts, which will be distributed to them, will enable them to adjust their procedures to align with COVID-19 safe reopening protections and adjust to the changes in the number of children that they are normally allowed to accommodate in this. We know that it is vitally important for our parents, for our child care providers, for our economy, that we increase the number of available safe child care settings. We also know COVID has put a strain on our child care providers in terms of the financial model and how they normally operate, and we want to move to try and ease this burden to help them get up operational and stay operational. The child care funding will be administered through a partnership with the YMCA Child Care Resource Services, the Child Development Association, and the San Diego Foundation. We want to thank, in particular, the San Diego Foundation for adding in an additional $10 million to support children and families' access to quality, affordable child care over the next few years, on top of the $25 million that the Board of Supervisors allocated. Child care, like access to food and housing, are some of the basic necessities that we recognize need to be provided, and so we are moving to try and address that. In addition to that, we directed $19 million of CARES Act funding to support food security programs across San Diego County. The money will be invested in providing support to senior food delivery programs, local food banks, and additional funding for small business program for restaurant support. A portion of this money will be used to shore up the Great Plates Delivered program. This has been a successful initiative in which we work with local restaurants to prepare and deliver meals for high-risk folks between the ages of 60 and 64 and seniors 65 and older. The FEMA money for this program is slated to run out by mid-September, and so we'll use about $7 million of our CARES Act funding to keep this program going for as long as possible. Also, an additional $5 million will be used to expand the eligibility of the program, which will allow between 1,500 and 2,000 additional seniors and people with disabilities to qualify. We're allocating another $3.5 million to support the San Diego Food Bank and Feeding San Diego through the end of the year to purchase for food for distribution. They will get an infusion of funds from the county. And then finally, we're spending another $3.5 million to bolster our small business stimulus program to support our restaurants. Each of the 5 county supervisorial districts will be getting about $700,000 to focus on restaurant. Supervisor Cox talked about the enforcement actions we took. I wanted to give 2 additional updates on pending issues before we get into our numbers for today. The first has to do with the elementary school waivers. As has been reported earlier this week, the state of California released information about waivers for elementary schools K through 6 that want to be considered for returning to in-person instruction. The state guidance outlines a number of things that they must do in terms of consulting with their teachers, with the community, with parent groups, and other things. We are working as a public health agency, our safe reopening team. We are working closely with the San Diego County Office of Education to finalize what the waiver process will look like here. We've been on calls with a number of the folks and are expecting by the end of the week to have a template available for our 42 school districts if they choose to consider applying for a waiver. They will have all of the information that will need to be filled in. After that, the process will be a school district will file the application for a waiver with our public health officer, who will review it, determine if any information is missing, if there's any questions or concerns. Once that process has been completed, it will be submitted to the California Department of Public Health for their consultation. They have said they will have up to 3 days to provide input. At that point, it will be returned to the public health officer for Dr. Wooten's final approval and decision-making on the granting of that waiver. As we move through this process, Dr. Wooten will be sharing more information around testing protocols that need to be in place. Our board also allocated $5 million of CARES Act money specifically for school testing to help assist in the process we need. And Dr. Wooten will also in the future be providing any additional information about triggers and their impact on those potential openings. And then finally, before we get into our numbers today, it was reported yesterday that the state of California is having technical issues with the data system being used to track COVID-19 test results. This is primarily from the commercial labs. Here in San Diego County, we have a great partnership and collaboration with our local labs, our local healthcare systems, and our hospitals through our health information exchange. The investment made over the years allows us to get this information and data about local sources of testing from our local institutions. But the commercial labs, which are a not insignificant number of tests, report those to the state. There's been a breakdown in that reporting system at the state. They're working to rectify it. Our team has been in contact with the state and are determining how many tests we're missing and over what time frame. We know and expect those to be shared with us in the near future. It would be irresponsible for us to try and guess or speculate as to how many tests are missing or what the breakdown is between negatives and positives. But when we get the missing data from the commercial labs in the state of California, we will report how many cases were missing, how many were negative and positive, along with our best estimation of what date those would have been reported, and we will adjust our reporting and numbers accordingly. With that, let's jump into today's results. Today, we are sharing a 7-day average of daily tests of 7,115. Our 14-day percentage of positive cases stands at 5.3, and you can see our cumulative numbers. We continue to see significant progress in increasing our 7-day average of investigations initiated within 24 hours. We're now at 73%. Remember, this was in single digits in the not-too-distant future, and we've moved rapidly to try and accelerate that. 87% of our close contacts are being traced within 24 hours. Again, the metric or trigger is to be over 70. We have an internal goal to be over 90, but on the metric slide, it's over 70, and so both of those have been brought in compliance with the stated metrics. And then you can see the public health motel rooms and convalescent plasma. Moving to today's number of positives, today we're reporting 348 positive cases out of today's testing totals of just under 7,000 for a 5% percentage of positive. And again, in the purple line there, you can see the daily rolling 14-day average of percentage of positive, which, as I just mentioned, is now at 5.3%. Hospitalizations just up slightly from yesterday. Nothing concerning, still a general downward trend from where we were back in July, but you can see the COVID of 125 in the ICU and total COVID hospitalizations of 392. Here you can see on the next chart our COVID hospitalizations 392, total hospitalizations, again, slight uptick from yesterday, but this number holding relatively stable and flat. And then my final chart is ICU utilization, which continues to be down a little bit from where we were. The 125 COVID-related, 322 non-COVID related for a total of 447, which puts us at 63% of our ICU beds are presently occupied. That concludes my section of the report. I'll now turn it over to Dr. Wooten for the Public Health Officer's update.
Thank you, Supervisor Fletcher, and welcome everyone to today's briefing. Today's global, national, and state statistics are based on data that we normally get from the Johns Hopkins dashboard around noon each day. Today's local statistics in San Diego County are from our reports as of 11:59 last night. Today, there's a total of 30,864 cases, which includes 348 more cases than reported yesterday. The overall total number of cases includes 578 deaths, and there are 10 new deaths reported today since yesterday. The age range is unchanged, 3 months of age to 102 years of age. The age group 20 to 49 years of age remains at 59% of all total cases. There are 15,802, or 51% of the cases being female, and 49%, or 14,958, are male. And only 104 individuals have no gender identification information provided. 2,655, or 9% of cases, have been hospitalized. 666 of these hospitalized cases have been admitted to the intensive care unit. And this number is 2% of the total number of cases and 25% of the total number of those hospitalized. The next slide reviews COVID-19 demographics related to hospitalized cases. Of the 2,655 hospitalizations, the 50 and over age group represent the majority, which is 1,885, or 71% of this total. Males represent the majority at 54%, or 1,442 cases. Hispanics or Latinos represent the majority at 1,507, or 61%. Also of note, Latinos also represent 61% of all cases. Of the deaths, the 579 total deaths, they represent 2% of the total number of cases. And 250, or 43%, were female, 328, or 57%, were male. 552, or 96% of the total death cases, had underlying medical conditions. 26, or 4% of the total number, had no underlying medical conditions. Previously, we had one individual that had died where there was unknown information about the underlying medical condition, and that has subsequently been identified, and that individual had no underlying medical conditions. So that actually added, Monday's report was 25 to 26. So at this point, all of those individuals that have unfortunately died, we know that, again, 96% had underlying medical conditions and 4% did not. And as always, our sincerest condolences and sympathies go out to the family and friends of those individuals who have lost their lives due to COVID-19. Overall, moving on, looking at our Epicurve, I want to show how state and county actions over the past 2 months have been implemented in response to daily cases. The Epicurve here is based on onset of illness of a particular case. And you can see that from the beginning, we were moving along. And then in early June, our numbers started to increase. And we have some additional slides that we'll show you in just a minute. But because the county had done so well, and that's indicated in the 2/3 of the Epicurve here, the state allowed counties to increase increase the opening up of various sectors. And that occurred on June 12th. That's the next slide, please. Thank you. This was followed by an increase in daily cases. In the next slide, after over almost half of the counties throughout the state getting on the state's monitoring list, including San Diego County, and because of an elevated case rate for San Diego, the state issued restrictions for various sectors, and this was done on July 13th. And it was effective in San Diego for July 15th. As you can now see, the numbers are beginning to decrease since those restrictions were implemented, going from 500 to 600 cases per day to now from 300 to less than 500 cases per day. In the next slide, this is just a summary of both of those actions, the opening up and then the dialing back down. Keep in mind that the area under the 14-day period will still show additional cases as this is the incubation period. So next, I would like to bring attention to the summary of all outbreaks. This slide shows that since the beginning of the pandemic, we have had 305 total outbreaks occurring in 3 categories: skilled nursing facilities, other congregate settings, and community settings. And community settings is related to our trigger number 2, focused on community outbreaks. And we'll talk about that in detail in just a moment. So of the 305 outbreaks, 178 or 58% are now closed or inactive, meaning that there have been no new cases in these settings in the past 14 days or longer. This leaves 127 or 42% of the 305 outbreaks that are currently active. Of these, 30 or 35% are in the San Diego County's 86 skilled nursing facilities. In total, there have been 731 residents, 470 staff that have been diagnosed with laboratory-confirmed COVID-19, and this includes 145 deaths. The next category is non-skilled nursing facilities or other congregate settings, and 34 or 27% of the 127 active outbreaks are in this category. In this category, there have been 686 residents and 520 staff reported, and this includes 93 deaths. Lastly, in the community setting locations, we have had 63 outbreaks to date, and this represents 50% of the 127 active outbreaks. Since March, the total community outbreaks have produced 1,220 cases, including a total of 11 deaths. Next, I will review the 13 triggers, and I am happy to report that you only see 2 abnormal triggers on the triggers dashboard today. Due to all of the efforts in bringing on case investigators, trigger number 11 is now above the trigger target, which is 70%. But the actual metric that we want to achieve for case investigations is 90%, and we anticipate that next week we will see that target reached. Keep in mind the 73% is an average of the last 7 days. Now, talking about triggers number 1, which is case rate, and triggers number 2, we will talk about those as those are still abnormal. For trigger number 1, as stated, this is related to case rate. This is the state metric that has us on the state's county monitoring list. This trigger reflects the rate of cases per 100,000 population for a 14-day period measured using the date of illness onset with a 3-day lag. So again, we have to go back in time 3 days and then the next 14 days, and you summarize, add up basically all of the cases for those 14 days, divide that by our population, and then multiply that by 100,000, and then that gives us the number that we see here. Actually, if you can go to the next slide, this shows a summary for the past 7 days for the case rate, and we have this metric has been decreasing since July 30th, when it was 34.4, and again today we are at 105.7. The results over the past 7 days, the 7 days plus the 3-day lag are, or minus the 3-day lag, are promising, and it is really thanks to everyone in San Diego that have done their part to change this metric. So we want everyone to keep up the great work, and hopefully next week we will see that particular metric also normalize. Now moving to trigger number 2, this is as stated related to community outbreaks. This slide shows the last 7 days, the number of community outbreaks, and currently we have 30 there. In the next slide, these are the 4 or 5 new outbreaks, community setting outbreaks that were added today. We have 1 in a preschool, 2 in businesses, 1 in a faith-based organization, and 1 in a restaurant/bar. Go to the next slide. So this slide actually is showing since July 29th through August 4th. This is the last 7 days. It shows those 30 outbreaks according to the various sectors that they have been assigned to, and these 30 outbreaks represent 122 cases. So as you can see, the top 3 categories include restaurants/bars, businesses, and then restaurants only. Going to the next slide. This is a summary of all of the community setting outbreaks since March 25th. And you will see 3 outbreaks representing 24 cases rather in March, all the way to June and July, when we started to see community setting outbreaks increase substantially. If we go to the next slide, this shows all of the community setting outbreaks since March, stratified by the various settings. So of the 164 outbreaks since March 25th, this represents 1,220 cases. And again, the same 3 settings are the top locations where our outbreaks for the community have occurred. These include the restaurant/bar and restaurants, as well as businesses, and then the healthcare sector. Next slide. And this slide shows since June 1st, again, the last 7 days, the settings that the 30 outbreaks, the outbreaks since the last 7 days are located. So there are a total of 137 cases, and the total at the bottom shows 34 outbreaks for the month of June and 98 outbreaks for the month of July, and we have 10 outbreaks just 4 days into the month of August. In the next slide. And lastly, again, this is not abnormal, but we wanted to show you the progression based on where we started, well above the curve in the beginning of this table, or rather graphic, on June 25th. And we saw our numbers plummet, and they hung around 10% or less. And then in the past 7 days, we've been increasing due to bringing on additional case investigators. So this is very good news, and we, again, as of yesterday, were not backlogged with any of our case investigation assignments. So this is definitely and indeed a positive finding. All right, next slide. And just in closing, again, thanks to everyone in San Diego, individuals, businesses, governmental agencies, and other sectors for doing your part to help improve our numbers. And this needs to continue. And we want to just remind people that washing your hands and promoting sanitation practices in businesses, as well as in your home setting and other locations, staying 6 feet apart, wearing your face coverings, avoiding crowds, and most importantly, staying home if you are sick. It will take all of us to do everything that we can do and to play our parts in contributing to continuing to decrease the numbers of COVID-19 in San Diego. Now, please welcome back to the podium Supervisor Greg Cox. Thank you.
As I mentioned in my opening comments, we're very fortunate to have some tremendous community partners, some nonprofit agencies that have been working hand in hand with the County of San Diego and our public health officers over the last couple of months. One of those is South Bay Community Services, who I want to acknowledge was one of our first Live Well San Diego partners. With us today is Mauricio Torre, who is he just got a new title change. He's a Vice President of Program and Operations at South Bay Community Services, and he's going to talk a little bit about some of the outreach we're doing with our community partners, such as South Bay Community Services. Mauricio?
Good afternoon. I'm going to talk a little bit about a project with the County of San Diego and South Bay Community Services and a few other partners. So this project is a collaboration between the County of San Diego, PCI, SDSU, and South Bay Community Services, with the purpose of reducing the spread of COVID-19 within our communities. The project will be implemented through teams of promotoras whose function will be to maintain continuous communication during the quarantine period with individuals who tested positive for COVID-19. Upon confirmation of a positive case, promotoras receive the information on the infected individual. Promotoras proceed to contact the individual within 24 hours. This is done through email, phone call, or even a text message. In special cases, in-person visits are conducted taking all necessary precautions. The continuous contact is done with the goal of keeping the individual well informed on the resources and actions to take to support the recovery process and protect the community's health. So who are promotoras? Promotoras are local bilingual Spanish-speaking residents who have built a trusting relationship with the community they serve. They serve as liaisons between community health and family support programs. All of our promotoras come from from the neighborhoods they serve. They've lived in our community for many years, have children at local schools we serve. Some are even alumni themselves. They are the neighbors we all know and trust. Some of their recent efforts include serving over 80,000 individuals at our food distribution site since the beginning of the pandemic. facilitating community leadership classes, conducting monthly meetings to provide resources and keep the community informed. Este proyecto es una colaboración entre el Condado de San Diego, PCI, SDSU y South Bay Community Services, con el fin de reducir el riesgo de propagación de COVID-19. El proyecto será implementado a través de un equipo de promotoras, cual función será el mantenerse en comunicación continua durante el periodo de cuarentena con individuos que hayan recibido resultados positivos de COVID-19. Al confirmarse un caso positivo, promotoras reciben datos de caso. Promotoras proceden a contactar al individuo dentro de 24 horas. Esto puede ser a través de correo electrónico, texto, y en casos especiales, promotoras hacen visitas en persona, tomando todas las precauciones necesarias. Este contacto continuo se hace con el fin de mantener al individuo bien informado con recursos, acciones que se deben tomar para apoyar el proceso de recuperación y proteger la salud de la comunidad. ¿Quiénes son las promotoras? Promotoras son residentes locales de la comunidad que hablan español y que se han ganado la confianza de la comunidad por ser enlaces de la comunidad y programas de salud y apoyo familiar. Todas nuestras promotoras son residentes de la comunidad, han vivido en la comunidad por varios años. Tienen hijas e hijos en las escuelas donde ofrecen sus servicios e incluso son graduados de las escuelas de su comunidad. Son vecinos que todos conocemos y quienes ponemos nuestra confianza. Algunos de sus esfuerzos recientes incluyen servir más de 80,000 individuos con alimentos a través de centros de distribución, extensa experiencia en encuestas comunitarias, reuniones mensuales con la comunidad para ofrecer recursos y mantener la comunidad informada. Gracias.
Thank you, Mauricio. And again, thank you to South Bay Community Services and all of our community partners that are doing such a great job of getting the word out. With that, we'll go directly to the questions.
The first question will be from Taryn Mento with KPBS.
Well, and
Sorry,
I
Taryn, go ahead. I
apologize.
unmuted you.
Thank you. Dr. Wood, I apologize, but I'm trying to understand a little bit more about how you reached the case rate of 105.7 that you're reporting today. Can you clarify the total amount of cases over the 14-day period that you're looking at? Because if you look back, it's about 5,700 cases, and dividing that by the population and then using the formula you used, I'm not getting 105.7.
Okay, Dr. Wooten will respond.
Oh, so let me explain again. First of all, you have to go back 3 days, a 3-day lag. And then from that point back 14 days, it's the number of cases for each of those days. So you have to be very clear on the dates that you're using. And you add that divided by the population. You have to be very clear on what population you're using. The state is using 3.37, and then you multiply that by 100,000. And that's the way it's calculated.
Can you provide the total number of cases that you are including in that 14-day period? Because also on the number you're reporting today and on the state's website, for the case rate, they're also different. The state, I checked it earlier today, it was 134.2, I believe, that the state posted.
And the state's going to be different. The governor's website is different. Again, it's very clear on what days you use. So exactly what I just described to you, I don't have the number of cases for each day for 14 days past the 3-day lag. We can certainly send it to you via email to show how we calculated that.
I'd appreciate that. I guess then my question is, if our calculation in the state is different, but the case rate matters, according to the state, then why are we following our calculation and not the state's? Because it's the state that will allow us to get off the monitoring list.
Well, for the case rates, our case rate, and if you saw the case rate today, is that for today's with our 398 or whatever the number, it wouldn't be with those numbers. It would be a 3-day lag. But again, I can send you the information and an explanation of why our numbers are exactly as I've just described them. Again, I don't know what dates the state has used.
I guess then my final question is just going to be then why are we not aligning with the state's calculation if the state is setting the metric that allows us to get off the monitoring list?
We are aligning with the states, but it depends on what point in time. And again, I have not looked at the state's website today, but again, we can show you and provide information as to how we've calculated the numbers and how it aligns with the state. We are using, and the state has a webpage where you go and calculate the numbers, and it's right there on the website. We are using the same calculations.
Can I get that info emailed today?
Yes, we can get that to you today after the press conference. Thank you.
Thank you very much.
Okay, we'll go to the next question.
Yes, next question is from Priya Sridhar with NBC7.
Yeah, Supervisor Fletcher, you touched on the state had some concerns with the electronic reporting system for infectious diseases, and I know you said during the press conference that it was commercial labs that mainly had the glitches in our area. Could you clarify how many commercial labs there are in our area and which ones had the glitches, and how big of an impact this could have on our numbers, since we are seeing a downward trend in the positive case rate, which obviously, as Karen just brought up, has some major implications as far as like getting off the state's watch list.
Okay, Supervisor Fletcher will respond.
I'm going to ask Dr. McDonald to walk through that. I think it's primarily two, but I'm going to have him walk through the commercial labs. And again, the commercial labs are a portion of the testing locally, again, for our healthcare systems, our county labs, those through our health information exchange, we get those. It is the commercial labs that are lagging, and I'll have Dr. McDonald kind of give some context of how many of those there are. But again, we don't know the numbers of what will be missing, but I'll have Dr. McDonald walk you through the commercial labs.
Thank you, Supervisor Fletcher. There are at least 6 commercial laboratories that local healthcare providers are using, actually, and the state is also using to conduct testing. Those tests are actually performed outside of San Diego, sometimes even outside the state of California. And those results are all sent to the state system, and then we get the results electronically from them. It's those 6 entities, including a major laboratory from Quest and also from LabCorp, which make up the bulk of these tests that we have not gotten results on different days. And so we are working with the state currently to get that information, understand where the glitch is, and the state has now authorized and actually directed those laboratories to now directly report information to the counties. So to have a redundant system so that we can get the information straight away instead of waiting to get it through the state. So that is actually being worked on as we speak. Again, those labs have not traditionally reported to us. They probably don't even know where to send the information, but we are actually in the process of bridging that gap so that we can get daily information and any back information that may be missing from those laboratories. It's important to note that the majority of tests that are done in the county of San Diego are actually being done by our local laboratories, our local health systems, resources like Helix, as has been described, supporting significant testing in the county. So we're very fortunate to have that system in place and those tests coming through our own health information exchange in a timely manner.
Thank you. And yeah, I guess
Okay, I think we have one final call-in question.
This next question is from Brandon Lewis with CBS 8.
Thank you. I'd like to ask about the enforcement funding that was passed by the supervisors yesterday. How much enforcement can residents expect out of this 35-person team? In other words, what's their capacity given the thousands of complaints that have already been submitted?
Let's see if Supervisor Fletcher wants to come up and respond to that.
Thank you. Thank you for the question. In the kind of first bucket of enforcement that was provided, that was 13 staff who will be dedicated on those egregious and very blatant, willful violations of what's happening, in addition to the efforts that we already do around outbreaks and pre-outbreaks. And so I think those individuals will get to as many as they can. In the second one, and this is where the board deliberated, the Board of Supervisors were presented with three options, a Tier 1, Tier 2, and Tier 3 for additional levels of enforcement. The board only chose to adopt the first tier there, which was 22 additional staff. This staff is dedicated to go out and investigate entities that are not allowed to be open under the public health orders. So this would be someone who, like a bar that does not serve food, that they can go out and do those. And so I think within those two categories, they will get to as many as they can, working hopefully in cooperation and coordination with local jurisdictions. So it's really hard to speculate on how many places they will be able to get to each day. Again, we'll have to triage the complaints as they come in and assess what is the most egregious for those first categories. And then the second, again, will be reserved for those individuals that are not allowed to be opening.
Thank you. And can I ask a question of Mauricio, please? Could you talk a little bit more about why the promotores you talked about are essential? What can they help do beyond what traditional county tracers, even those who speak Spanish, cannot do?
Yeah, I think the main piece is they are known within the community. They're trusted individuals within the community. They go through extensive training, and the big piece is what we want to do is make sure that all community members receive correct and factual information. And what we've seen is many times some community residents may not feel comfortable, or when somebody calls them up, they may not be able to engage because they don't recognize the person on the other line. These promotoras are known individuals, have been providing leadership classes, informational classes. They are deeply embedded in each one of the communities. And what we've seen historically is community members that have had difficulty connecting, whether it be services or to information, because these resident leaders are familiar to them, they're more apt to pay attention, to listen, and to engage.
Thank you.
Okay, that completes our call-in questions. We do have a number of texted questions. And I believe this first one is dealing with how the compliance teams will function. Supervisor Fletcher is going to respond.
Okay, and this question is from Claudia with Univision. Can you share how the compliance teams will operate once they receive a complaint about a business that is not following the county health orders?
Thank you for the question. It really depends on the nature of the complaint, the information that's been provided. There could be an initial contact via phone or some other mechanism to try and reach out and understand what's happening. But they are empowered to go out and physically go to that location, perhaps most likely in coordination and collaboration with someone from that local jurisdiction to try and inspect and see what is happening. And then if there is an issue where there needs to be an issuance of a public health order or a cease and desist letter, then we would work with the local law enforcement agencies to serve that notice. Similar process to how we've served in the enforcement actions we've taken to date. We're just trying to increase the personnel and the resources to be able to respond to more of these and respond quicker to these situations.
And Supervisor Fletcher, her follow-up question is how much will the fines cost?
The fines for violation of the public health order are $1,000 per instance.
Then the next question is from Abby Alford with CBS 8. The Ocean Beach Town Council would like enforcement at Veterans Plaza. There are large gatherings in violation of the health orders. They've asked San Diego Police, but we're told it is a county issue because the county handles enforcement. Is the county aware of the issue, and who will enforce breaking up large gatherings at that location?
Yeah, I would like enforcement there as well. We are aware of what's happening, and we do expect to have safe compliance teams engaging with those gatherings, again, working with their partners in the city of San Diego to try and address the situation there that's been ongoing.
This next question deals with the casinos and their operation, and I believe Dr. McDonald is going to respond to that question.
Okay, so this one is from Mike McKinnon with KUSI. Casinos have been open for weeks with no reported outbreaks. Would you suggest Gavin Newsom allow other businesses to reopen if they put the same safety protocols in place?
That's a great question. I appreciate you asking it. We routinely ask all individuals who are reported with COVID-19 where they've been in the 2 weeks prior to the onset of their illness. And we have had a number of individuals who have visited casinos during that time frame. And we do have also some employees of casinos who have come down with COVID. Those cases and the investigations are actually under the jurisdiction of the tribes themselves. And so questions about outbreaks and the numbers of cases should really go to them.
Dr. McDonald, if you could stay up there, there was a question from Lindsay Winkley with the Union Tribune about the state testing. She wants to know if you could explain what sort of glitch caused the lag in reporting.
Actually, we don't know what the electronic problem is in getting the information to us. I know that the state is actually actively investigating that. We've been working on our end to see if it's a problem of receiving electronic information, but it does not appear to be that. So the state has actually really got the lead on trying to figure out where the information is either being dropped or stalled. Again, we don't really know at the local level what is causing that.
Thank you, Dr. McDonald.
This next question deals with action of the Board of Supervisors yesterday in regards to the use of county parks, and Supervisor Fletcher is going to respond.
And this one is from Saddam with Univision. The County Board of Supervisors approved use of parks for fitness classes. Is there any specific protocol that needs to be followed? And how is the county going to manage the schedule for the use of parks?
Thank you for that question. That was just approved today, just a few hours ago. And so we do try to move fast at the county. We're not quite that fast. So given it was just approved a few hours ago, we'll be working with county parks to release the guidance process to apply and scheduling in the coming days. And I want to commend Supervisor Diane Jacob for bringing that measure forward as we look to find more creative ways and opportunities to do things in outdoor settings, which we believe are safer. We still want to be responsible. We believe are safer. I think this is an important step that could help in fitness and religious observances in a better setting. So we will, in the coming days, be able to release and provide you more guidance on what that will look like. And again, appreciate Supervisor Jacob bringing it forward and the entire board for supporting it today.
This last question deals with compliance of restaurants and bars that have been noted to be in violation of the public health orders, and Dr. Wooten's going to respond.
Okay, this one is from Carlo Chiquetto with News 8. We've seen restaurant bar for the location of recently confirmed outbreaks. Are those from restaurants and or bars that are currently open and operating in compliance with the public health order?
So first, thank you for the question. And first, I'd just like to provide some context. As everyone knows, COVID-19 is widespread throughout the community. And as Dr. McDonald stated, when we are investigating an outbreak, we look at where that individual has been in the last 14 days, and the three individuals that are from separate households. And it may not mean that there is anything going on wrong at the restaurant or the restaurant/bar. For all of our outbreaks, most of our outbreaks, we do deploy an assessment team. And if they are restaurants, Department of Environmental Health has taken that role until as of Tuesday, when that will now be under the compliance program. In going out to the location, there's a checklist, making sure all signage is up, that employers are practicing sanitation and proper hygiene, that people are wearing their facial coverings, and that there's social distancing. Except where there's a situation that's related to Department of Environmental Health issues that will require closure, these outbreaks are at locations that are operating. And again, we send or deploy a team out to make sure that all of those top 4 practices are in place.
That completes the questions for today. Again, thank you for your participation. We're not scheduled to hold another media briefing until Monday at 2:30. However, our coronavirus website will be updated regularly, and our communications staff will continue to provide those updates to the media. Until Monday at 2:30, please stay safe, and again, protect yourself. Thank you.